Am I audible?
Yes, ma'am.
Okay. Just give me a minute. It is really interesting to know how many of you see HIV patients in your practice. In your setting, in your region, how commonly you see HIV patients? I'd like to hear from you, either in the chat or anyone can unmute, or how frequently that you see patients with HIV. Anyone? Do you see HIV commonly in your setting, or is it something that you don't come across? Manjeet, Sarita, Pooja, can anyone tell me how commonly you see this in your setting? Otherwise, there is no point in moving ahead, right? Wait for the response.
You can unmute yourself, or else you can use the chat box also.
Can everyone switch on their videos? Because I'm not sure if everyone is attending the session. I've been asking this and waiting for last 4 minutes. There is no response. So can you please switch on the video and have the session? Otherwise, there is no point. If this is not relevant, if you are not listening, there is no point in proceeding with the session. So it should be good to have an understanding whether you are there or not.
Participants, please respond yourself. Our faculty is waiting for your response.
Good afternoon, ma'am.
Yes, Pankaj, please.
Actually, ma'am, your voice is not clear.
So how many of you, is it clear now?
Yes, ma'am. Yes, ma'am.
Better now? Yeah. So
Yes,
how many of you are seeing HIV patients in your setting? How often do you see? That was my question. It is not, I'm not just asking to Pankaj because Pankaj unmuted. I'm asking everyone. If people are not listening or responding, then we cannot proceed with the session, right? What is the point in me sharing a lot of slides and talking? It is not of no use. We are doing this session so that we share our understanding. I want to hear from you also. Yes, I can see one response. Manish is telling you've not seen HIV patients in their setting. Anyone else? Because you are all from a different state. I am from the state of Kerala. The incidence of HIV is very different in my state. It is very different in your state. So we have to set the background. Yes, now I can see a few responses. Not seen. So maybe, so I am assuming that maybe Uttarakhand is a state where, like in Kerala, there is not much of HIV patients that you see regularly in the community. Can someone tell me, is palliative care is needed for patients with HIV? In your understanding, why do we need palliative care for patients with HIV? Is it because that it is a scary disease, or is it because that it is infectious? So why do we need palliative care services for patients with HIV? Do you think it is needed? I agree with quality care, but is there anything specific to HIV than in many other non-communicable diseases? Sangeet, just let me know if my voice goes low, okay?
Sure,
Because of the
ma'am.
background noise, I won't be able to understand.
Okay, ma'am.
So I'll just, so at least some people are responding and they feel that palliative care is needed. So what happens is that when someone is diagnosed with HIV, it is not just HIV that is affecting them. What happens is that along with HIV, there are many other psychosocial issues. Definitely, we all know about it, but there are lot of comorbidities that they are affecting. Lot of comorbidities. It is not just HIV or immunocompromised state or infections or spread of infection that is what they are facing. There is a lot of psychosocial and comorbidities that they come up with. So this is the picture of HIV in India. In the early 1985 or 83, when it was first diagnosed, there was a rise in the number of cases in early 2000. Like in 97 till 2005, there were a lot of patients. But now, with all the ART treatment regimens and all the policies and the drug availability made by the government, in India, the incidence of HIV or the trend of HIV is coming really down towards the 2020. So what happens? What is the current picture of HIV? All of us might have heard about HIV newspapers or televisions where people say that they are not admitted to school, or the villagers throw stones at them and they die. No one takes care of them. They are abandoned. And whenever they are diagnosed, they die. They have a very pathetic death. That is a common picture that we have heard. But right now, there are a lot of medications available for the treatment of HIV, a lot of antiretroviral therapies. So what happens? People live longer. So when people live longer, what happens? They are living with all these problems for a longer period of time. Initially, they used to die very soon. Now they are living longer with a very poor quality of life. Lot of issues for another 15, 20 years. It is like taking care of a incurable HIV or pulmonary fibrosis or lung diseases for a longer period of time. And if you are seeing diabetes and hypertension at the age of 50s or 60s in normal population, for patients with HIV, you can see all these illness in their 20s or 30s. Whenever they are diagnosed with the illness, within a few years, they start having so many other illness. It is not just HIV that they are dealing with. There are a lot of other comorbidities that they are dealing with. So I'll just show you the chart. So before the ART treatment, the antiretroviral treatment, which is called pre-heart AIDS, before the heart started, it was like cancer. You get diagnosed, suddenly your health deteriorates and you die very soon. You can see the dark, the bold blue line. The dotted line is the current picture of HIV. You get diagnosed with HIV, your health very gradually deteriorates. In between, you will have some issues for which they may have to go and get admitted, but their progression is like a cardiovascular illness or a congestive cardiac failure. It is slow and it is prolonged period of life with lot of comorbidities. So how do they die? Whenever a patient with HIV dies, how do they die? Some of them die because of AIDS-related causes, because they become immunodeficient. They'll have a lot of infections and they can die. And many other will die from non-AIDS-related cancers. They die from liver disease. They die from cardiovascular disease. So,
Ma'am, your audio.
Sorry, I think accidentally I got muted. So these are the reasons how people die with HIV. It is not just AIDS-related causes, but people can die of cancers, liver disease, and cardiovascular disease. They get all these illness as a part of their HIV journey. Once they are diagnosed with HIV, they will get all these illnesses as a comorbidity. So what are the comorbidities? It is also, again, I'm emphasizing, it is not just HIV that is killing them. These are the other illnesses. They will have cardiovascular disease. They will have lung disease. They'll have liver, renal, and bone disease. And there are a lot of cancers that come along with HIV. And cancer can be AIDS-defining cancer or non-AIDS-defining cancers. Certain cancers like Kaposi sarcoma, you might have learned in your education, and if you have not seen patients, you might have learned Kaposi sarcoma, cervical cancer, lymphomas. All these are AIDS-defining cancer. People with AIDS may have those cancers, but there are cancers which are non-AIDS defining, which is not related to AIDS, and they also have psychiatric and premature frailty. So when should we start giving palliative care for patients with HIV? So what happens is that they are very sick in the first 6 months. They'll have all sorts of symptoms in the first 6 months. And it is very crucial that first 6 months they find it very difficult to accept the illness, how to live their life, how to live ahead, how to get treated. So all the psychosocial distress happens in the first 6 months, plus physical symptoms. So what are the common physical issues that we come across in HIV? Can someone tell me, even from your textbook knowledge? We have all learned from textbooks, right? We have all learned from textbooks at least about HIV. What can be the problems seen in patients with HIV? Can there be any physical issues? Can there be pain? Can there be breathlessness? Or you learned a lot of symptoms, right? GI symptoms you learned, delirium you learned. So what do you think can be the physical issues? I understand many of you have not seen HIV patients, but I'm sure you have learned HIV even in your training. Some of you might be working in an ART center maybe. So I'll wait for your response. Very correct, Anjali, weak immunity. So because of the immune system issues, what happens? They will get a lot of infections. Their immunity is very, very low. So they'll get very frequently fever, or if someone at their home is sick, they'll get. I'm glad, Dr. Deepak, you talk about joint pain, although you have not seen much of patients. It's very common. I'll tell you why they have joint pain. So,
Hello.
Yes. Yes,
Actually, ma'am, 1.5 month back, a female patient around 50 years old. She came with a history of having very good urine problem and all that area. So when she was referred to our higher center, so she was diagnosed with cervical cancer area. So then she came to us, and she was having this immunity weak and fever, and anxiety was there in her area because of all of a sudden she was diagnosed. So she was having pain, joints pain, and indigestion problem was also there with her area, and some kind of all that basically from apart from physical, there was some mental symptoms also there area.
I can imagine it would have been very difficult. Lot of things, right? Whatever I've told, it is not just HIV. It comes with, as you said, she had cervical cancer, lot of pain, and we have learned about GI issues, and then a lot of psychosocial issues, because suddenly you get diagnosed with a very threatening illness, right? People will be scared than cancer to hear about the HIV diagnosis. Thank you for sharing, Dr. Deepak. Yes, weak immunity, frequent infections, nodes in the body, very, very correct. So all these physical issues come along with HIV. I will not emphasize a lot on physical issues, but I'll just go through it because if you see a patient, you should ask for all this. You should check whether they have all these issues. So I'm just showing one table. That's all. Sorry. This is one table that you can remember. It is very similar to cancer symptoms or cancer patients going through a lot of symptoms. They'll have a lot of tiredness, fatigue, anorexia. They'll have different types of pain, nausea, vomiting, breathlessness, difficulty in sleeping. So all these symptoms that we see in cancer patients also. It is very similar to that. And a lot of depression, anxiety or agitation, difficulty to cope with the illness. So these are the common symptoms seen in patients with HIV. And there are a lot of pain syndromes. I've been working in Kerala for my entire life, and I took a year to work in state of Karnataka. There is the place, and I was working specifically on HIV and cancer, and interface of HIV, cancer, and palliative care. So I was specifically working on patients with HIV with palliative care needs. Then I came to learn about all these. It is not just a simple pain. They have a lot of pain syndromes which happens in HIV. One is sensory neuropathy, which is the most common neuropathic pain in HIV infection. And they also come, this is the clinical presentation. I'm sharing this with you because you are community health workers, health officers. You will be seeing a lot of patients. Maybe in future, I don't know the HIV status in Uttarakhand. I'm so sorry for not doing that background. But if you come across a patient, if they are talking about pain, you have to ask. There can be painful feet, like they say burning in the soles, and they say numbness or distal weakness. And they also can have autonomic symptoms like constipation, urinary retention, and everything. So they can have distal painful sensory motor polyneuropathy. That is, multiple nerves can be affected. And why joint pain? As Dr. Deepak mentioned, they are very prone to have arthritis. We have all learned about reactive arthritis or Reiter's syndrome in our college days, right? So this happens for patients with HIV. They'll also have polyarthralgia. That means the larger joints of lower limbs and shoulders will be affected. So they'll complain of joint pain like any other arthritis patients. And multiple, and they also can have HIV associated arthritis and psoriatic arthritis. And as you said, their immunity will be very weak. This can cause infection in the joints, which will cause septic arthritis. So, lot of rheumatologic pain syndromes are seen in patients with HIV. This can cause joint pain. So, that's why I'm glad when you brought up joint pain. It is very common because we don't ask. And generally, pain is alleviated. Either you can remove the causative agent if possible, or we have learned about the WHO analgesic ladder. So, the same medication can be used to give pain relief for patients with HIV also. So I'm not continuing with more physical symptoms because today's session will focus more on the psychosocial issues. So what happens when we tell someone that you have HIV? You're all familiar with telling patients with cancer, right? We say you have cancer. We're all familiar with that. But what happens when we say someone that you have HIV? So the life completely changes. How? The life completely changes once you hear that you have HIV. They start questioning themselves. For some patients will say that, okay, I knew I have done something very bad in my past, so I knew that something will come up. But some people, so that is confirmation of what they were expecting. For some people, it will come as a surprise. I don't know about this lady, Dr. Deepak, whether it came as a surprise because, as you told, initially she was diagnosed with cervical cancer. No one could have thought about having an HIV in that. But maybe because of the immunocompromised state or many other symptoms, they would have checked or screened for HIV, and then it might have come as a surprise for her. or maybe she knew that she may have chances of getting HIV in the future. So we are actually telling them a very contagious, infectious, and a life-threatening, very stigmatized and transmissible illness. It is very different from whatever illness that we are dealing with. And what happens when they hear that you have HIV? So generally, first, they will have a normal response. They will try to integrate. But then they start questioning about many aspects of the life, right? They start thinking, where did I get this from? How did I get this illness? Unlike in cancer, we know many cancers, we don't know how do they get it. But HIV, we know that it is a sexually transmitted disease, or it can be transmitted through transfusions or mother to child. We know the transmission routes. So obviously they will think, okay, where did I get this from? And why? I was very cautious in my life, or I've taken all the precautions. I have not been in a hospital, but how did it happen to me? And who is going to take care of me? And the individual is likely to experience shock, sometimes lot of guilt, shame. They just don't want to talk to anyone. And what happens? There are a lot of counseling services. I don't know whether you are aware of every ART centers will have ICTC. The counseling centers are attached in every health center. Supportive counseling is available, but people don't take counseling because everyone in your village will know when you go to an ART center. So why would you want to go for counseling in a ART center nearby your place? No one wants to go there. And what happens? Fear. Generally, they might have heard about people having HIV being suffering, thrown out of the house, loss of employment, violence, rejection by others. So for them, their normal life has completely ended. So they'll get scared about many stories they might have seen. And there are a lot of employment issues. People change the nature of employment. So when I was working in a hospital for HIV, so I was talking to a lot of people, and then I came to know that one of the nurses, she was a head nurse there. She got diagnosed with HIV a few years back because people think that she can spread the infection. She did not lose her job, but she was taken away from patient care. She was doing something behind the computer so that she's not spreading the infection. There was another guy, or many people, many people, they are kicked out of the employment. The moment they share this news of HIV, generally they are kicked out of their employment. And very commonly, violence. People who are diagnosed with HIV is very commonly they face violence from either from family members or by their village or their relatives about having this illness, although it is not their fault. And generally, most of them are rejected by the family or the society. Has anyone heard or come across these kind of rejection stories? People being abandoned because they have HIV. Do the families abandon them? No. I have heard in newspapers and televisions before I started working, but I thought it is all just a news, very sensational news, or people are making it up. But when I started talking to such patients, it is real. They are subjected to a lot of violence. They are treated very badly. Even with TB, it is much more higher in HIV. So what happens to their mental status? If they have a previous psychiatric illness. So what happens generally? They get HIV from either from drug abuse, or mostly, I'm not telling everyone has drug abuse, but many of them will have history of substance abuse, drug abuse in the past, or some they might have engaged in some sex work. So they what happens is that they will have the exacerbation of the previous illness. There can be increase in depression, more substance abuse because now they have an illness to deal with, and sometimes elevated sexual behavior. They may even think, okay, anyway, I got it, someone gave me, so I'm going to spread it across. I'm not going to talk about it to anyone. Like a sex worker has actually shared with me that I thought, okay, someone punished me, somehow I got this illness. I should not talk about it. Men who come to me, let them all get HIV. I don't care. So those are the initial reaction. That is when they need the counseling service. Or people with substance abuse. Now you are going to start with ART drugs. It can have a lot of interactions. So we have to be very careful in screening for psychiatric illness in the past and dealing accordingly. What happens in
Hello.
yes, Dr. Deepa? Yes.
Ma'am, actually, when I was in my training period, internship period, we were having duty in our TB department area. So there a female lady came with a complaint of TB area. So when she was done all the checkups area, she was found HIV positive area. So our senior sir then he asked about the how she got and all that. So she told ki her husband was having HIV positive, but he didn't tell her. And after that she just got in, and then her in-laws area they sent back her to her parents area. Ki you can't live with us right now area. It was around 5 or 6 years ago area.
Thank you for sharing that. Everyone, especially I'll come to it again, especially females, when they get it, even if they get it from their husband, even if this person had HIV before marriage, many of them are accused that you gave the disease to him. It might have come through you. I mean, we didn't know about anything. So all this, and sometimes what happens is that, so I met a couple, both of them are HIV positive, the husband and the wife. The husband is so caring. So wife got diagnosed with cervical cancer, very advanced. So he's being, she has having a lot of vaginal bleeding and pain and other issues. So I was treating her pain basically. So yeah, he was very kind to her, his wife, taking care of her really well. So I asked him, like, generally people abandon their wife. Like, I can see you are taking care of her really, really well. I mean, can you tell me why you are doing this? So the thing is that he knew that he had a child, but he wanted to get married because otherwise everyone will ask why you are not getting married. So he did not tell this to her at all, and he knew how he got it. He was involved in a lot of unprotected sex in the past, and he did not tell her. When she got the illness, he was so guilty. I know that I have given her this illness, so it is my duty to take care of her really well. That is so nice of him, I agree. But it is not coming out of love. It is coming out of the guilt that I cheated her. Now it is my responsibility to take care of her. But the wife is so thankful and admiring him like a god. Oh my god, my husband is taking care of me really well. Although she doesn't have any clue how they both got the disease. So lot of issues that we have to talk about, especially when you start working in palliative care. People would want you to ask all these and address all these things. And what happens when someone having depression? So they say if it has a reciprocal negative impact. If your counts, CD4 counts are very high, or your if CD4 counts are very low and your viral loads are very high, you have more chance to have depression. Otherwise also, like if you are depressed, it is highly possible that your counts will go down. So it has a reciprocal negative impact. Persons with HIV can have depression, and when the depression is there, it can aggravate the viral load. So these are reciprocal negative impact of depression in patients with HIV. It is not very simple to deal with. And what are the risk factors? Gender, I'm talking about the risk factor for depression. Female people are more prone to have depression. If you are elderly, if you are homeless, if you don't have a family support system, if you don't have a self-esteem, then you are more prone to have depression when diagnosed with HIV. And now we are talking about, we told the patient you have HIV. What is the next step? The patient will have to tell others that, okay, see, I am diagnosed with HIV. How will they tell that? Sometimes, many times the physician. So I hope all of you know that there are laws in disclosure. You cannot talk to patients' illness to the relatives without patient's consent. If I have HIV, I have to be informed first. You have to get consent from me to talk to my husband or my children. Without my consent, you cannot disclose this to anyone else. But does that actually happen in our country? Do we talk to the patient first? But I mean, HIV, it happens much better than in cancer, I agree. But ideally, we should not talk to anyone else without my permission. So whenever the physician say, diagnose, I mean, I used to sit in the HIV clinics with the physician. So then they encourage them to share it with the family members. All of them are scared. They just don't want to disclose this to others. Can someone tell me why? Why they don't want to disclose? Anyone? Why people don't want to disclose their HIV status to the relatives, to their loved ones? Unacceptance, I agree, Pooja.
Fear of negligence.
Yes, fear of negligence. Like I said, sometimes people can actually that can actually cause harm. Social stigma, yes, fear of disrespect. It's considered as a dirty disease, right? Shameful, yes, very, very correct. It is not like cancer nowadays, people understand. They say, okay, kids also get cancer, or even if you don't do anything, you will get cancer. But it is very different in nature. Fear of being judged. Very, very correct, Chaitanya. I'm glad that you all, although you have not seen, you have some clue about what they might be going through. So, why they don't want to disclose? It is same as you said. Sorry. Yeah. First of all, stigma. They are all scared because HIV is a very, very stigmatizing disease. Like, what is the point anyway? Why should I tell? Anyway, I got it. And like many of you said, fear of rejection, fear of hostility, fear of violence, and guilt. Someone told it is shameful. Yes, guilt. And they say, so many times they feel that, okay, now onwards, I will do safer sex. So I don't need to tell. I'll be very careful now onwards. So these are the reasons why they just don't want to disclose. I have come across a lady. She was a very young lady, not one lady. This is a story of many. Uh, um, so she got an antenatal checkup done, and during that antenatal checkup, she was diagnosed to have HIV, which she ultimately got from her husband. Husband knew he had HIV. The moment she diagnosed with HIV, the good doctor did not tell her about the diagnosis. He called the father-in-law and her husband and told about the diagnosis. She overheard them talking, and the husband and the father-in-law was actually planning to poison her because now she is going to give birth to a baby. The baby can also be positive because the husband was hiding the truth from the woman, and they have not gone through the way they should conceive a baby. They should have taken treatment or something before that. So they were planning to actually poison this lady because she got diagnosed with HIV. That too she got from her husband. So she ran away from the family. She lived on her own. She gave birth to the baby. I mean, she started working on her own and continuing her life. But this is the story behind that. How do they disclose? How do they tell others that they have HIV? One is voluntary disclosure, and many times they ask us, Madam, I know I have to share, but can you help me? I don't know how to share. But can you help me to talk about this to my wife or my family? Yes, that is a time where we need to help them. Many times doctors disclose without consent and sometimes partial. And what happens to children? It is very, very difficult because the parents don't want to disclose. And the children, they have to take these tablets for a lifetime. And they don't know why they are taking this tablet. So what happens? They will make follow-ups will not happen. I mean, they have to carry this tablet to school. At least their friends will ask, no, why are you popping pills all the time? What pill is this? And they don't know. And if there is a label, children are very bright. They will Google it and say, and then they will know they have HIV. So what happens is that I've been talking to a parent. So they say, They get the medicine, they remove all the labels, they put all these tablets in a small white transparent some dabbas and give it to the child. And the child doesn't want to take, because why am I taking tablets without having any illness? You can say multivitamin. How many years you will say that you have to eat multivitamin? They'll stop taking it. So poor adherence to treatment can happen. And when they come to know, if they disclose to a child, generally the children at the teenage mostly, that they get so angry towards their parents. I mean, why did you give such a dirty disease to me? So I met with a lady, a girl, she was around 21, and her parents were HIV positive. She was positive, but her brother was not HIV positive. She hated him, because I am HIV positive, I am dealing with illness, you are living a normal life in the same house. She hated her brother. So there was constant fight in their family. The brother was helpless. So he came and asked, can you talk to my sister? So she met someone who is willing to marry her, knowing her HIV status, but she doesn't talk to her brother. So he feels very bad. I mean, is it my fault that I did not get the disease? So all these issues come across. And for caregivers, why do they do this? It is not that they hate. Always it is not because that they hate the other person. It is because that they don't have any clue how to deal with this illness. Now they have to go for work, they have to take care of their children, they have to change their role, responsibilities. They are scared of getting illness for themselves. They are scared of death of their husband. They are also going through depression, self-isolation. They cannot have a healthy sex relationship with their partner. So all these things are going in their mind. What happens to sex and sexuality? The moment they diagnose with HIV, then we don't talk about sex, because you got it through your erratic sexual behavior. That is very, very sad, because they want to talk about it. Initially, they will have generally, because of fear, they will have a decrease or decline in sexual activity, and they stop having sexual relationship with their partners. But once I've talked to one person, he told that the doctor told it is okay to have protected sex. You have to have protected sex. It is okay to continue. But what happened is that he asked me, all of a sudden, I start using condom. My wife will ask me. So because he want to hide the truth, he continued having unprotected sex. So how dangerous it is, because people are scared. They don't want to talk about it. So they don't want to take. All of a sudden, everything changes. The wife will be suspicious. Wife will ask, when these many years we lived together. Now you're doing all this drama. Why? So he continued having unprotected sex, which ultimately led to transmission of HIV. And most of them are not ready for marriage, even if the partner is okay in the diagnosis, very rarely, but they are not ready for marriage and they are very scared about childbirth. And about gender, we know that in India it is heterosexual transmission, it is not homosexual. Majority of Indians get this infection through heterosexual. 25% of this are women. And many of them are from a very poor socio-economic status. But I'm talking about women. So, but even though the woman is suffering, she has to be the caregiver. That is a fact, not just in HIV. This is a study done in India. So, this is a sentence in that study. The majority of those who shared their HIV status with their families were looked after by family members, because it is not because our family is great, because it was largely men who received such care. So when the men get diagnosed, they share the news. The wife generally takes care of them. But if it is a female, if they share the news, she is generally abandoned. Women undergo violence, denial of shelter, property. This is what I told about that woman who got pregnant and got diagnosed with HIV. And one very interesting sharing. So as like Dr. Deepak said, the wife and the husband both had HIV. So when I was interviewing them separately, I was talking to them separately. So if the man is getting this disease, either from the female, the in-laws are telling, oh, my son got it from you only. So then it came that he got it first. Then what is the story? because you did not satisfy your husband really well. He had to go out, and that is why he got the disease. So, whatever way it is, women are the reason for bringing in HIV to the family. And many a times, sometimes very, very rarely, because of guilt, they take care of their wives. So, this is the problem in gender. And what is stigma? We all use the term stigma very often. What do you mean by stigma? Stigma is a devalued status attached to a condition by the society. So society is reducing your status attached to a particular condition. Here the condition is HIV. And for when there is a stigma, they have less power, because I need to have power of no HIV to stigmatize on another person. So it takes a lot of, they have lesser power. There are different types of stigma that I'll come to in detail. What is enacted stigma? Do we stigmatize our patients? Do you show stigma? Do you discriminate if they come to you? I know many of you have not seen HIV patients, but those who have seen, do you show any stigma? Will you discriminate if they come to you? Have you done that in your unknowingly or unknowingly? Have you seen someone doing it? Maybe your seniors, maybe your administrators or anyone. Have you seen someone doing discrimination, treating them differently? What happened to that patient, Dr. Deepak? Was she treated differently from others?
No, ma'am. Actually, the sir have treated him likewise. He was treating every other patient area. She was actually she came to sir with her sister area. Because
Okay.
she was actually they have not told to her parents area, so she said ki, okay, she is not feeling well, that's why she have come to home area, but she have given
Okay.
that news to her sister, but her
Okay.
sister was standing with her and she was
Mm.
taking care of her. Our sir also told us this thing ki we have to not discriminate on the thing, and he was saying ki, okay, don't worry area, we will just give you medicine, we'll start some more tests and all that thing area. So there was no such kind of any discrimination over there area.
Yeah. So what happens when we when suppose we have to examine HIV patients? What are the precautions that we take? This general question. I know everyone knows this. If you have to examine someone, examine an HIV patient, do some procedure. So this patient had a cervical cancer. Maybe a, a PV. You have to do a PV, or you have to draw blood. What all precautions will you take? That everyone else can answer. We all learn this when you are doing your education, right? Although you are not seeing your patients, what precautions should we take when we are treating HIV patients? Anyone can unmute, or should I call names? Anyone? Yes. Universal precautions. Avoid direct contact with blood. How will we avoid direct contact with blood? Wearing gloves, PPE. Agree. So thank you for some response in the chat. Otherwise, there is no point in this. Is not didactic. We are sharing our experience here. So this is what the patients feel. We talk about universal precaution, but what we do precaution when we see there is HIV positive or hazard, biohazard on ART written on the file. Suddenly we remember universal precaution and we keep double gloves. Do you use double gloves? When I used to use, I completely accept my ignorance. I used to use double gloves when we come across HIV patients. That was what being told or taught to us. Double gloves. all the during dressing, we suddenly go and take gloves and wear. And usually in the wards, they will be near a window or they'll be given separate rooms. In my own hospice, when I was having this knowledge before that, we used to give white linens. But when the HIV patient come for admission, we don't give the green sheets, we give the white linens. So I asked, why do we need white linens? Because we have to put it in the bleach. If it is green color, the color will go off. So white is easier. So what do you mean by universal precaution? Every patient to be treated as HIV patients, right? We don't know anything. Universal means universal. Every patient that we see should be treated as patients who can give you infection. It can be hepatitis, it can be HIV. But only when we see patients with HIV or hepatitis, maybe now during COVID also, we start wearing all the gloves and PPEs. So what patients feel? The doctors are actually enacting their stigma unknowingly. Only when they see me, they will wear gloves, madam. So once the rounds is over, the next bed patient will ask me, is it something wrong with you? Because all the doctors and nurses wear all these gears when they come near you to draw your blood. They drew my blood without wearing anything. Are you contagious? So they face all these questions once you leave the room. Or you are given separate room. You have separate waste baskets. You have white bed sheets. We have green bed sheets. So they face all these questions once we are done with our own drama of dressing up when we go near the agent. I completely agree that we are okay to touch them or just give me a minute. So when we are doing all this in the name of precaution, it has to be universal. You don't need to give precaution to a few people there and so that they will be in trouble. So they don't want to go to hospital. Others will completely know with all our dressing drama that there is something wrong with this patient. I have heard people doing verbal abuse, head of the departments shouting at patients, throwing their files to the junior doctors, passing off the case because they don't want to touch. Poor standards of care at some place. And even if they are not stigmatizing, they're generally their body language. When the nurses, especially the junior nurses or people, when they go near them during the rounds, there'll be certain body gestures that they do, which is very evident, which is very clear. These are all unknowingly we are doing. And we put double gloves and all those protective gears. There is another type of stigma. This is called enacted stigma. We act without knowing about ourselves. That next is felt normative stigma. They are scared of encountering discrimination. They are scared, if I go to that particular place, will they be discriminating me? And already they are having a shame internally. So I know that I've done something wrong. I have a very dirty disease. I'm very scared to go to hospital. What if they discriminate me? That is called felt normative stigma. The other one is internalized stigma. Thing is that they accept, okay, I am bad. I have done something bad in the past. I am worthless. This is a punishment for my bad deeds. So when I was sitting in the OP, one lady came in. That is not in Karnataka, not in an HIV clinic, in Kerala. When in our palliative care OPD, suddenly the lady came in. I saw we have written very clearly or under ART treatment, whatever. So I just asked her about her pain. How are you doing? Did you have food? I did not ask any questions about her HIV. Then she showed me the file. Madam, did you read this? I told, yes, I read that. But you did not ask me anything. I told, I don't want to know about anything. Like she was telling, whenever she sits in front of the doctor, everyone is curious how you got the disease. So she was a sex worker in the past. So she started telling her story. I told, not interested how you got the disease. Okay, what are you doing now? Who is there to help you? What are your symptoms? How can I help you more? So she has accepted that I have a discredited status, or have done bad things in the past and I am feeling worthless. That is called internalized stigma. And to overcome this, so I'll tell you an example. Today morning around 10 o'clock, I'm getting a call from someone very well known to me. He was our patient. He is an HIV positive patient. His whole family has the illness. And when I was working in Karnataka, Through him, I used to help patients from Kerala travel across the border, come to Karnataka to get the HIV treatment. So when I stopped working there, they did not have access to that particular hospital. So today morning I got a call. There is one patient. Can you do something? Why? What do they do? If I have an ART center near my house and getting medicines for HIV, will I go to that center? Because there will be known person ever there. No, my neighbors will be there. Maybe some ASHA worker will be there, or your neighbor, or some okay, my neighborhood person is working there as a nurse. Why would I go there and get the HIV medicine? So people don't want, although the complete treatment is free from the government. They pay in private hospitals. So I was working in a corporate setting. They pay for the tablets and they travel across the border. They take room there because it's very far. So a lot of things they do, travel from home for treatment just because of the stigma. They do not use counseling services. They do not use government schemes. So I don't know how many of you know, there are schemes in the government where HIV patients will be given money to build homes. They can build homes if they have a plot on their own. Small bedroom, some square feet house, the government will provide. No one is utilizing the scheme. Why? Because you have to do a paperwork. You have to go to your nearby village office. You have to get it signed. So everyone will in the village will know you have HIV. How you got this house? No one wants the house. And they lie about reasons for getting the treatment. They say, I'm going to Karnataka to get. So I asked this person, if you everyone come to Karnataka, will they ask you, why you're going there? Can't you show somewhere near? They don't. We will tell some other reason. We'll say TB. We'll say cancer. We don't say that for what treatment I'm going. And they keep the medication secretly. They remove all the package and the stickers and they keep it. And this lady with cervical cancer has a terrible bleeding at night. They did not take her to nearby hospital. She would have died with hemorrhage. But they did not want to take her to the nearby hospital because there they have to disclose. They started driving overnight to the next state. They crossed the border and they went to Mangalore in Karnataka and then they took the treatment. So they don't seek treatment in any other hospital so that they can hide the status. And very interesting finding, very shocking also. We all know that how difficult it is to talk about cancer. People don't tell the diagnosis. People don't disclose. But in patients with HIV, when they get diagnosed with cancer, they feel so relieved. So the son of a mother, so mother was dying of HIV. She was having cancer. She was dying actually, and she diagnosed with cancer. It was very advanced, the cervical cancer. So this, when we disclosed, we were all prepared. The son is going to find it difficult to handle. The son told, Madam, I'm relieved. Now I can cremate my mother's body when she dies with dignity. Now I can tell my villagers that, okay, my mother died of cancer. Otherwise, they would ask me, how did your mother die? She was losing weight for quite some time. So they get relieved when they get a news of cancer. Men-to-men transmission in India, we just don't talk about it because they have problems in talking about homosexuality. They have to reveal, so they just have to reveal their sexuality. Plus, they have to talk about HIV, and there is a lot of pressure to get married also. So, I'm talking about a whole lot of problems that they go through. How can we help them? When we use simple things, I'm not telling you big stuff. I'm not telling you to do counseling services or treat anything or anything. Simple things. The words that we use. We use body fluids. It is transmitted through body fluids. Body fluids means everything. Sweat is a body fluid for them. Urine is a body fluid for them. So we have to be very specific while talking to them. And when we don't use the word AIDS anymore, generally we use HIV and AIDS. Where person living with HIV, person living with AIDS, person living with we generally don't use HIV victim or HIV sufferers or contaminated. And we still use the word biohazard in many of the files. In your case document, what we use biohazard. How can they become hazard? And all of us, we don't know our HIV status. How many of us have checked ours? Encourage them to open up to you. Many a times what happens as palliative care worker, you will get more chance to talk to patients. So we have to encourage them to open up to you. Give them space. We may not be able to solve their issues. It is huge, but give them space to talk to you. Manage their symptoms. As Dr. Deepak shared that joint pain, manage the symptom. We may not be able to cure the cervical cancer, but we can always manage their symptoms. Help them to talk to you. Help them to talk to their other family members if they want. No extra precaution. Follow universal precaution. Universal. Why do we use the word universal? Universal means everyone. With everyone, you have to take precaution. It is not just for HIV patients. Even when I prompted you, what will you do when you take care of HIV patients? Everyone was so clear. I will wear gloves. What about other patients? Why do we call it universal? For every patient, you have to do this. You can't say the excuse autoclaving will be easy if you use the instrument in the last, or sterilizing will take more time. That is not the reason. It is universal. Have a clear understanding and knowledge about HIV infection and eliminate fear. Talk to people. Eliminate their fear. They are going to live longer with ART. They are not going to die soon. And let them interact. If your health workers, if your nurses, if your ASHA workers are scared, let them interact with patients with HIV. Then they will understand what they're going through. It is important to have conversations with family members. Tell them they are scared. They just don't know about the illness. They are stigmatized. They are scared. Maybe help them to understand about the illness more. That can give more of a family experience. Lot of support groups are there for patients living with HIV. Lot of support groups. That helps a lot. They have a lot of rehab works. They talk to newly identified patients and they say how to cope with particular issues, clarify doubts. So encourage them to participate in support groups. If any of your employee or if you come across such things, give confidence to continue with the employment. Or teach them some trade so that they can contribute to their family. And if they want your help for disclosure, help them to disclosure. Tell your counselor or you yourself can talk to the patients, but only with the consent. Identify depression. Use your depression screening scales. Check for suicide risk because it is very highly associated with the diagnosis. Sorry, I am not using the example during pandemic, but you can understand. People travel from one state to another to get the treatment for HIV. During pandemic, what happened? The borders closed. People stopped taking medications. Although it was readily available in the nearby centers, they stopped taking medications because they could not travel to Tamil Nadu or Karnataka or nearby states so that they can get medication. And understand their prognosis, understand their illness, understand their symptoms, and do proper treatment. Talk about the psychosocial issues. Lot of guilt and fear, talk about it. And if you can coordinate, okay, I don't want to go and see the person in my own village. If you can talk that doesn't be other ART clinics, just coordinate those kind of things. And when the things are bad, going bad, when the prognosis is bad, help them to plan end of life care, including where they want to die. It is very difficult to find a hospice where HIV patients can come and die. Many hospitals do not take them when they are dying because they are infectious. So understand, help them to plan and prevent care. So with that, I'll end my presentation. If there are any questions, I'm happy to take. We all agree that unknowingly we all discriminate by doing all this universal precaution stuff.
You can ask your doubts, or you can also share your experience as well.
Anyone agree that without knowing we would have discriminated by wearing extra gloves and gowns and glasses and stuff? Or if there are other questions, I'm happy to take. Great, Pooja. If you have not done that, that is well and great. I used to do, because we have seen our professors doing whenever HIV patients come, when we have to draw blood or you have to do an ascites tapping or some procedure, everyone start wearing gloves. Till then, everyone is comfortable. So I have seen it also a lot. In 1 year, I have seen in many places. We just unknowingly do it because we know that we have to wear gloves. Yeah. Thank you for sharing that, Pooja. But when they do know, they don't understand it is discrimination. And we say, no, I'm not stigmatized. I don't discriminate. So I used to talk to doctors as well as to patients separately. So first question I asked them, do you discriminate your patients with HIV? The first was, no, I don't discriminate. I talk to them, I sit with them, I put my hands on their shoulders, I eat with them. I don't have any stigma. But when they have to undergo surgery, I post them in the end, so that sterilization is easy. Otherwise, I'll waste a lot of time in sterilizing the instruments. Or I use disposable. I use disposable stuffs. I use goggles. I use shoes while doing surgery. Others, you check this HIV status at that point of time, they are negative, but we don't know. So it is universal. You have to treat everyone as HIV patients ideally. I'll wait for another few minutes if they have any questions.
You can put your questions in the chat box also.
Maybe if there are no questions, we can stop the session.
Yes, ma'am. Thank you, ma'am. That was wonderful and informative session. Thank you for joining. Thank you all for participating. Thank you. Let's see you in the next session. Bye.